It being just past 6 p.m., I'll go ahead and call the Winnebago County Board of Supervisors to order for October 28th, 2019. If all members could please press their attend button and silence any cell phones. First item on the agenda is the Pledge of Allegiance, followed by the invocation by Supervisor Locke. If you could please all rise. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And now Supervisor Locke with the invocation.
Bless us as we gather for this 2020 budget meeting for Winnebago County. Guide our minds and hearts so that we will work for the good of the community. Teach us to be generous in our outlook, courageous in the face of difficulty, and wise in our decisions. Amen.
Thank you, Supervisor Locke. Next item on the agenda is a motion to adopt this evening's agenda, and for that, I'll call on Supervisor Albrecht.
I move to adopt this evening's agenda.
There's a motion and a second to approve this evening's agenda. We'll do a voice vote. All those in favor say aye. Aye. Opposed? Motion carries unanimously. Thank you, Supervisor Albrecht. Moving on down to the next item, and that is the time in the evening in which we allow an opportunity from anyone from the public to speak on any item on the agenda this evening or any issue under county jurisdiction. Is there anyone who wishes to speak this evening? Is there anyone who wishes to speak on any item on the agenda or anything under county jurisdiction? I'll say one last time, is there anyone who wishes to speak? Seeing none, we'll go ahead and close that portion of the agenda and move right down to the next item, which is reports from committees, commissions, and boards. Any reports from any committees, commissions, and boards? Seeing none, we'll move on down to the next agenda item, and that... Did I miss you, Supervisor Eisen?
Oh, I pressed the wrong button.
That's quite all right. Go right ahead, please.
I pressed the green button.
Please go right ahead, Supervisor.
Thank you, Mr. Chairman. I humbly report. I report attendance at the East Central Wisconsin Regional Planning Commission mini-conference held in Neenah, Friday, October 25th, on funding for resilience in disasters. And my principal takeaway was a listing of federal and state funding grants available and the point of contact with federal and state personnel who deal with these programs. Thank you.
Thank you, Supervisor Eisen. Any other reports from any committees, commissions, and boards? Seeing none, we'll go ahead and close that item. We'll move on to the next item, and that is County Board Chairman's Report. So first, I'd like to let you know that Supervisor Roble and Supervisor Powers asked to be excused. Also wanted to let you know that tomorrow, as a reminder, is County Government Day. So the students from throughout the county will be learning about county government, touring the facilities. Will actually be with us after the lunch hour as well. And as a part of that, the American Legion does host a luncheon at 12 noon. It'll actually be at the American Legion. And so if you're interested, tickets are $6.50. You can purchase them from the clerk anytime this evening or tomorrow. So certainly encourage you to do that as well. And that concludes my report. So moving on down to the next item, and that is our only item for this evening, and that is resolution number 233-102019. Adopt the 2020 annual budget. Is there a motion? There's a motion and a second to adopt the budget. Just wanted to give a brief overview to make sure that everyone's on the same page in terms of the process. So that now brings the budget to the floor. And what we will now do is review each area of the budget. So tonight we have 10 areas that we're going to review, time permitting. Goal would be that we can complete and finish up this evening between 8 and 8:30, or earlier, just depending on how we move through this evening's items. Then we'll continue tomorrow morning at 8:30, and we'll continue reviewing the other areas of the budget. Anytime during this budget process, anyone can offer up an amendment that we will consider once we are done with the review. So if at any time you do want to offer up an amendment, there are these pink sheets. You can write your amendment here. You can talk as well to the finance director to clarify what your amendment and a potential budget impact may be. When we're done with the review, tomorrow or the subsequent date, just depending on how long the review takes, that will be the time in which we will begin to then take up the amendments. We will not take up any amendments until we're done fully with the review. Once we're done with all of those amendments, that's when we then officially adopt the budget as amended. Okay? Any questions at all in regards to the process? Okay, I'll call on Executive Harris to begin the process.
Well, I want to start out just by giving you a little bit of overview on the budget. This budget is actually decreasing both the operational rate and the capital rate. The operational budget is coming down roughly 16 cents and the capital rate down 2 cents. But what you have to understand is that the levy freeze that we've been subject to for years and years requires us to cut our equalized tax rate so that we're offsetting any revenues we would get from appreciation of property. We actually have to cut the rate to offset the growth in the base due to appreciation. The only increase we're allowed based on the state rules is the increase from new construction. And the amount of new construction as a percentage of our tax base was, I believe, 1.37%. So we're operating with that really thin increase in the allowable levy. And we've been subject to that type of limit for years now, you know, generally under 1.5%, some years under 1%. And it does put some stress on the budget. The average homeowner, which they're not interested in what our equalized rate is, they're not interested in this process, they're interested in how does it affect their tax bill. Well, properties on average should be roughly flat in terms of their taxes. Any existing property will probably be taxed very similar to the prior year on average. But I can't actually say how every individual property is affected because there's other factors involved. For instance, if in your community there was a change for dark stores where a large retailer had their assessment dramatically dropped and their market value dramatically dropped for the dark store exception, that's going to shift taxes off of that taxpayer, and that, of course, is then made up by others. In a community where the manufacturing property assessed by the state, where it's given a lower assessment each year, that shifts that tax burden as well. And TIF districts, or TIDs, can also cause a shift in taxes. If your property has appreciated more than the average property in the county, that will shift taxes your way. If your property is appreciated less than the average, that'll shift taxes away from you. So on average, people should see their county portion of the tax bill stay roughly flat. But I can't say what will happen with each individual property. We are, however, taxing at the maximum allowed under the levy freeze. So if people want to make modifications to the budget, that can be done, but be aware if you're adding additional expenses, you either have to cut some existing expense or you have to take it from reserves, effectively taking it out of savings to pay for it. And the board can do that. I would just caution, if you're taking money out of reserves for a recurring expenditure, then next year we have to deal with that same amount of money again. and either take an additional amount of reserves to pay for it, or not continue that recurring expense. So it's a complicated process, but we are actually in good financial shape, and we should be able to get through this pretty smoothly.
Executive Harris? I see one question in regards to
Sure.
those initial comments. Please go ahead, Supervisor Eisen.
Yes. Mr. Harris, you said that if we tax to the max, we can increase the levy by 1.37%.
That's correct.
Is it necessary that we have to increase that?
No, you could take less or even cut the levy, but generally,
If we passed a budget which was less than the 1.37%, then we wouldn't have to tax to the max.
that is correct. And taxing
Thank
to
you.
taxing to the max is probably a misnomer when you're talking about 1.37%. But here's a follow-up that you have to understand. If in a given year you decided you wanted to cut something and take less than the amount allowed to you under the levy freeze, the base that the subsequent year's levy freeze would be applied to would be smaller. So you effectively, if you took $500,000 less than what you were allowed to take, you would not just be cutting $500,000 from that tax year, you would be cutting $500,000 from every subsequent tax year as well, as long as the levy freeze was in place. So people just have to be aware of the consequences of what changes they make. And Vicky's a real expert on this as well and can help you with questions as well as myself to explain to you what the impact would be over time. So I think we're going to start out with highway. Their chart of personnel is a couple pages in on page 305. I'm sorry, 305. The highway department is increasing personnel by one person, going from 84 full-time to 85 full-time. They're continuing with 2 part-time, the same as last year. And my understanding is that the additional personnel are needed because of additional work for the state. You've got the chart of significant changes on page 306 and 307. And the highway maintenance is largely reimbursed by the state.
Any questions in regards to the highway budget? I see a couple call-ins. First, I'll call on Supervisor Bender, followed by Supervisor Eisen.
I guess I just question that $45,000 pickup truck again this year. We bought 2 of those last year. I don't know why we couldn't piggyback off the sheriff's department. They buy them all-wheel drive Ford Explorers or Travis. They're around $28,000. I know the shop supervisor, the last pickup truck he got had leather interior, and I think these are supposed to be work trucks. They're really not basically supposed to be decked out personal vehicles. I mean, I realize they take them home every night and they use them as a personal vehicle, but the taxpayers are paying for them. And I don't think there's no reason we should be paying $45,000 for a pickup truck, that we could easily get something in, like the sheriff's department, they drive in them in all types of weather and all types of conditions. And if it's good enough for the sheriff's department, it should be good enough for the highway department.
Yes, some of the things you've just mentioned, I heard them from you earlier tonight for the first time, but raise in the back of the room and perhaps he can answer your question more directly.
Highway Commissioner, please go right ahead.
Sure. I didn't catch all of your question, but I think I heard the gist of it. You were questioning the supervisor's pickup trucks that were ordered this year?
Well, I know Doug's got leather interior in his. I really don't think we need leather interiors in a pickup truck for a work truck. I mean, that's a bit extravagant. Half the people here don't have a leather interior in their vehicle. Our taxpayers, a lot of them can't afford a leather, you know. The sheriff's department gets the Traverse and the Ford Explorers. They get them through a state contract for about $28,000. They're all-wheel drive. You got 7 people that basically have personal vehicles that take them home at night. I don't think we need 7 $45,000 pickup trucks. We bought 2 last year for Dan and John, I don't know who we're buying this one for, but I think we need to basically reel that down to the $28,000 benchmark. If we're gonna have 7 vehicles, we're gonna be buying 1 or 2 every year.
Right, and I don't have what we paid for those with me tonight, but I don't believe they were $45,000 apiece. I believe they were, there was 2 trucks purchased for that cost, so I think that was a cost
Last
for
year
2.
was 2 trucks, and you budgeted 90,000. I don't know what you paid for them, but this year you budgeted 45,000 again, so I'm assuming if you're budgeting 45,000 again this year, you must have paid close to 45,000 last year,
Yeah, and
or
those
you'd have budgeted what they were.
And those are off the state bid as well, yeah.
But I don't see many state people having leather interiors, and I
Yeah, I
know
guess I
Doug
didn't-
has leather interior in his truck.
I
And
didn't-
they have remote starts, and, I mean, they're not just your average work pickup truck that Northeast drives. I was out at the park today, Northeast is paving the park shelter, and they have work trucks.
Okay.
Thank you, Highway Commissioner, and thank you Supervisor Bender. Next speaker, Supervisor Eisen.
Oh, thank you, Mr. Chairman. I have a two-part question. First part is, Ray, could you explain, share with the county board, kind of give us a report on the completion of the interchange of Interstate 41 and Highway 10. The state has completed that this year, and my two-part question is, number one, are there any problems, or give us an update? And second, what is the impact of completion of that on our highway maintenance?
Well, to answer the first part of your question, I believe the state is ahead of schedule with their project, and they're planning on having the interchange at 41 and Highway 10 is completed. That's been completed. They're finishing up their work with the median barrier wall between Midway Road and Oneida Street, you know, down on that end of the project. So they're wrapping things up, and they're hoping to have things done by the end of November is the last report.
Okay, so there's still work being done.
Yes.
Even though it's fully operable.
Yes, they have one lane closed in each direction, just to allow their construction activities. As far as the impact to the highway department's maintenance activities, you know, it's gone from 2 lanes in each direction to 3, so obviously it requires a lot more effort on our part to maintain, for winter maintenance especially.
Is that reflected in our budget?
Yeah, and our state routine maintenance agreement increased this year because of the increase in lane miles.
Okay, so then the cost for maintaining that is reimbursed to us or is paid for by the state?
Yes, the state contracts the highway department to do all their maintenance work for
Okay, so
them.
there should be no particular impact on our budget from that project.
Not directly, no.
Thank you.
Thank you Supervisor Eisen. Thank you Highway Commissioner. Next speaker, Supervisor Bender, followed by Supervisor Brun.
One other question I had under your professional services, in 2019, we're at 108,000. This year, we're at 340. What are we getting done for the professional services for that kind of increase?
Professional services, that is the cost of all of our design engineering that we have. So we have projects that are planned for design. County Highway P is coming up. We have the project in on Pioneer Road in County T that'll have design work done. So it's all the design services that we have through the state. A lot of them have state grants, and then all those run through our books under professional services.
You got epoxy one half a parking lot. Is that supposed to be one half a parking garage, or?
Yeah, that's a typo.
Okay.
Yep.
Thank you Supervisor Bender. Next speaker, Supervisor Brun.
I was wondering about the vehicles going out of the county. It's still occurring, I imagine. And you also have in here as a revenue, taxable benefit of $20. I can't believe that someone that can take a truck out of our county only has to pay $20 for a taxable benefit to bring that vehicle home all the time. That's my comment on it.
and Vicky, you can correct me if I'm wrong, but I believe they follow the IRS process for that, rules?
Yes, that would be on their W-2, so that would be under wages for that. So these taxable benefits have to do with taxable meals or taxable clothing,
Not
not
use
the
of
personal
vehicle?
use auto. That goes right on their W-2 form, so it shows up within their wage area.
I'm not quite sure on that myself, but okay.
Thank you, Supervisor Bunn. Next speaker, Supervisor Gabbard.
I have several questions for you, Ray, but the first one is regarding towns and the maintenance that you do in the townships. In particular, my township. I know that you have the state comes first priority and then the county. But I guess my question to you is every year the towns sign a letter that are having the county do some of their work. And are you figuring that dollar amount in your budget? This year in particular, our town didn't get a lot of their work done because you were terribly busy, and I understand that. But if you're including that in your budget, and I think you know the letter I mean that they sign every January saying that they will commit to so much dollars being done by the county. So I'm wondering how that's going to work and if we can get any improvement on that. I talked to a couple of the workers out at your department, and they were concerned about the health insurance going up, that their deductible is going up, and that's a big deal for the average working person. And I had heard that it was going up to a $4,000 deductible. I'm going to ask Mike later on about this, but my concern about that is, so I see that there's an increase in health insurance of 6% in the premiums, and how is that ferreting out for your employees? And then I was going to ask about those 2 pickup trucks, but Mr. Binder already asked that question, so I won't ask that again.
To answer your first question about the town maintenance agreements that you were referring to, yeah, we have, most of the townships in the county sign a maintenance agreement to have the county perform their winter maintenance for them. In exchange for the county committing the resources and the equipment to do that winter maintenance for them, they agree also to perform an equal amount of work in the summer to justify us buying and purchasing that expensive equipment and staffing it. So the budget does include what we anticipate for work in the townships, but the amount of work we do fluctuates from year to year. It depends, a lot of times townships will have state funding available to them, or they'll have the county do a lot of paving projects for them. So our revenues will increase dramatically when there's those types of projects, but then the years that there aren't state revenues available, then our revenues decrease as a result as well. The second question was regarding what again? I was having trouble. Health insurance. Yeah, I guess maybe that might be better answered by.
I'll get it from Mike later, that's fine.
Yeah, I really can't comment on that, so.
Thank you, Commissioner Polonen, and thank you, Supervisor Gabbard. Any other questions in regards to the Highway Department budget? That would also include County Road Maintenance Fund on page 317.
And I'll just comment that the county road maintenance is the maintenance of our county roads. We're not reimbursed by the state for that maintenance work. So that does largely hit the levy. And that's page 317, you can see the list of significant changes.
Any questions regarding the County Road Maintenance Fund? Seeing none, we'll go ahead and move on to the next department. That's Clerk of Courts, starting on page 221.
On page 226, you have the chart of employees. The clerk of the courts is actually decreasing 1 employee in the budget. It's going from 43 full-time people down to 42. 2 part-time people for a total of 44, which is 1 less than in the prior year. The chart of significant changes is on 227 and 228.
Any questions in regards to the clerk of courts budget? I see one call, and I'll call on Supervisor Eisen.
Thank you, Mr. Chairman. On your accomplishments, which are listed on page 224, you describe the remodeled clerk of courts offices as a one-stop shop for customers. Could you explain to us what you mean by being a one-stop shop? I know that you had several locations previously, but could you explain to us and to the public what that means?
Clerk of courts, Melissa Pingle's in the back. Please go ahead.
Yes, I can. When I first started in 2012, we actually had 4 offices in the clerk of court's office. We had 3 offices on this floor, and then we also had family court, which was on the 4th floor. So when you came into this very confusing building, you had to figure out where you were going, and then you could ultimately have to go to a few offices to figure out where you were. So my intent always was to have us be in one central place. So when you came into the clerk of court's office, you were at the clerk of court's office, and we could help you. So this relocation project finalized that.
Thank you. And has it been received well by the public and by the employees?
The public, yes. The employees, less yes. But we're working on, we're just a little tight in there.
Thank you.
Thank you. Thank you, Supervisor Eisen. Seeing no other call-ins for the clerk of courts, we'll move on to the next department. That's the county executive's departmental budget. Starts on page 77.
Yes.
Please go right ahead.
On page 79 is the department staffing. The department remains a 2-person department, myself and John Fink. And there actually is no significant changes in the department from the prior year.
Any question in regards to the county executive's budget? I'll call on Supervisor Eisen, followed by Supervisor Bender. Supervisor Eisen, please go ahead.
Mr. Harris, I've observed this for over a decade, but my question is, how do you handle your secretarial work?
Well, John Fink does all of that. And then we divvy up some other duties. John does attend some of the committee meetings. He prepares all the paperwork for county executive appointments. So he does largely all the support work.
Thank you.
Thank you, Supervisor Eisen. Next speaker, Supervisor Bender.
In 2018, I asked if we could bid out the insurance on basically to a private carrier, and we didn't do it. I asked you in July if we could do it for 2019, and you told me you'd look into it. And once again, we didn't do it. Our insurance is going up 6.1%. The city of Oshkosh is going down 7-point-some%. We had a meeting today, and Outagamie County's chair from the finance committee was there, and they went with the private insurance because they were self-funded the same as us. They said they saved a boatload of money, and once again, we didn't even bid it out. We could have took exactly the same insurance that we have, and we could have asked the private carrier to give us a quote on exactly the same coverage, and we could have went to our taxpayers and said, yes, we did our due diligence, and we can't save any money, or we can. But we asked, I should say I asked you 2 years in a row.
Yeah.
I don't know if I'm just like, don't exist here, And no matter what we say as a board, we have no meaning. But maybe it's time for us to look for a county administrator, somebody that's accountable, because it doesn't pay for me to ask you to do something if you won't even give me the time of day to look it up. I mean, I feel like my position here is useless, because no matter what I ask, Mike Collier writes me a letter and a half why we can't do it. You basically tell me you're gonna do it and ignore me. Well, we're 36 people here that have no voice.
We hire a firm, it's associated, they're consultants on health insurance, and they gather data and provide us to us knowing our options. But I think what you're really talking about is that some employers get a substantial discount on their rate if they will give an exclusive to one provider. But when you do that, and we've done that in the past, but when you do that, typically you're getting a teaser rate for 1 year that doesn't stick around long. And you're forcing all your employees to change their health care providers.
Outagamie County signed a 3-year agreement with that insurance company. So they got a guaranteed rate for 3 years. We didn't even look into it.
Well, we actually do get quotes from Jan Stage, who's our consultant with the Associated Group. And Mike Collar may have more to add, but we do go through a process. We have made changes different times. But if you're making a change that's forcing your employees to change their medical providers frequently, there's a quality of health care issue there as well.
Wouldn't you agree, a 3-year contract, you would know what you're gonna pay for health insurance for 3 years? That's what Outagamie County is signing, a 3-year contract for health insurance. You don't know what health insurance is gonna cost next year. You don't know what it's gonna cost the year after that.
Well,
And
we're self-insured, of course, so that our costs relate directly to the medical costs of the employees.
they were self-insured too until 2018. They had 6 catastrophic claims and their premium went up $1.5 million. And that is why they're going to private pay now. I just think,
Well,
when
you're-
somebody asks, as a county board member, to get a basically bid out the exact same policy, I didn't ask you to cut down on the benefits, I said bid out apples for apples, so we know if we're paying too much to administrate this policy. But once again, in 2018, nobody did it, in 2019, nobody did it. I'm gonna ask the finance director to give me a cost of what the difference would be between 18 and 19 to our employees, so that I'm gonna bring up a amendment so that the employees pay the same in 19 or 20 as they paid in 19. So there's going to be no increase if I could get my other supervisors to support me to the employees, because they shouldn't suffer for our due diligence of not looking into it.
Well, you know, there was a year not long ago when we switched, and we forced everybody into what I think at the time was Affinity or Ascension Group to save money on a 1-year basis. Well, then the quotes went up the subsequent year, and there was a huge pushback from the employees who didn't want to change the providers that they could have. So it's part of a benefit package, and
Right.
it's
If you
perceived as
could've got a
being
3-year
less
contract-
valuable by the employees.
Yep, you could have got a 3-year
If they have
contract,
to-
maybe just like Outagamie County, and you could have guaranteed them the same coverage for 3 years. You
Well,
didn't even look into it.
Perhaps Mike can address it, but, you know, it's a judgment call. We are self-insured, not fully insured. Our costs relate to our actual medical expenses. But even if you're with a fully insured plan, over time, that insurance company has to charge you what the medical costs are, plus a profit. So.
Yeah, if you could get me what the cost is, like the employees in 2019 paid so much money for their health insurance, and the increase is gonna be 6-point-some% extra they're gonna pay this year. I would like to know what that is gonna be, so I can basically put that in the budget, because I don't think the employees should pay 1 penny extra for their health insurance, because we didn't get a bid to see if we could have been actually saving money. The city of Oshkosh saves 7%, Outagamie County saved money. There's no reason why our employees have to pay more.
And I will work with the HR director for that because he does hold the insurance numbers.
And somehow we have to have that probably by tomorrow in order to basically get an amendment, because last year when I wanted to do it, they said it would take too long to figure it out. That's why I'm asking you to figure it out, so I'd have it for tomorrow.
But understand what you're doing then. What you're doing is you're saying that the employees who want to be able to stick with their providers and seem to prefer if we don't keep changing the plans around and making them switch, you're saying, all right, we gave you what you wanted, but we're not going to make you pay for it. Well, that puts us in a position where we're forced to then shop it and bargain it and force everybody to switch their healthcare
What I'm
providers year
trying
after
to do is
year.
force you into getting a bid next year, because
We-
you won't do it again, because you lied to me 2 years in a row.
I didn't
and
lie to you.
You won't do
We-
it again.
Okay.
We
so-
use a
So
consultant.
I've let this go on
Yeah.
long enough. It's actually back on the agenda later under Human Resources. We'll give you an opportunity to get the information, okay? So let's move on. Any other questions in regards to the county executive budget? I see two other call-ins. First Supervisor Eisen, followed by Supervisor Nussbaum.
Thank you, Mr. Chairman. At this point, I'd like to share that I think what Supervisor Binder wants is for a supervisor to introduce a resolution to require the Human Resources Department to present the renewal budget for the insurance to the county board, like they did for the first 10 years that I served on this board.
Thank you, Supervisor Eisen. Next speaker, Supervisor Nussbaum.
Thank you, Mr. Chairman. I just want to say that I was forced to change my insurance this year, and all of our doctors, we got to keep all of our doctors in our family. Thank you.
Thank you, Supervisor Nussbaum. Seeing no other call-ins for the county executive budget, we'll move on to the next one, and that is Corporation Council. And that starts on page 88.
Corporate counsel is increasing from 4 full-time people to 2 full-time people, and that relates to bringing in the commitments that were done by outside counsel in-house. The summary of significant changes is on page 89.
Any questions in regards to the Corporation Council budget? I see one. Supervisor Eisen.
Thank you, Mr. Chairman. Corporation Council, could you share with the county board your new arrangements with your new employees in your workspace in the Orrin King building? Because it has come to our attention at the Judiciary Committee that there is some turf issues in respect to another department wanting space that belongs or that has accommodated your new employees. Could you share your dilemma with us and whether there is a budgetary solution that we can provide to you?
I'd be happy to, Supervisor Eisen. Actually, I'd like to provide some follow-up information regarding the issue the DA touched upon at the last board meeting regarding the Office of Corporation Counsel's office space. I believe the Office of Corporation Counsel is an effective department, and in order to remain as effective as it is, the Office of Corporation Counsel location needs to remain where it is. As the supervisors know, or most know, we are the law firm for the entire county. We handle children in need of protection of service cases, guardianships, protective placements, mental health commitments, because as County Executive Harris noted, we have brought that in-house. We handle appellate work. Certainly, public defender, when there are appeals, the appeals are not handled locally. They are handled in Madison. Our office handles appellate work. In fact, we are right now in the process of drafting a brief to the Supreme Court involving a case of first impression. We review contracts. We provide legal advice to various departments. We provide advice to boards. We assist with civil forfeitures. We handle 980 placements, the sexually violent predator placements. We handle substantiation appeals. Now, the reason I say we need to stay where we are is because when I became corporation counsel, I personally chose one of the smallest offices in the suite because of its strategic location. This location is critical to conducting business. When I'm at my computer, I can see opposing counsel going into and out of the courthouse, and I routinely walk out of the back door and conduct business. A lot of business, I can tell you, is taken care of in that parking lot. Our office's attorneys go to the courthouse numerous times per day. Now, are the customers of the programs that the DA is talking about going to the courthouse that often? Let me refresh the board's recollection. When the Office of Corporation Counsel was located on the 3rd floor, the Office of Corporation Counsel did not have enough space. And now we have 50% more staff than we did back then. I learned today that the DA's proposal to facilities is to provide the Office of Corporation Counsel with 1,400 square feet. We are currently occupying 4,000 square feet. This space proposal that the DA has indicated is not feasible. You can ask the experts. I see Mike Elder in the back, the facilities manager. Another important point not to overlook is that we have adapted our department to the location. Why is there such an intense need for the Office of Corporation Counsel space when the district attorney refused that space in the past due to safety concerns? The Office of Corporation Counsel was compelled to move to the 1st floor as opposed to taking over more space on the 3rd floor because of the district attorney's safety concerns. Why is it so important to launch a pilot program in the Office of Corporation Counsel office space when there is other available opened space that is not being used? What is the benefit of displacing an established department from space that is critical for its operation when there is other space not being used and available? What is the benefit of displacing an established department for a pilot program that you have not even been provided a white paper for, the specifics, the in-depth information regarding it? I believe, Supervisor Eisen, these are important questions that I would ask you and the entire board to consider.
Anything else, Supervisor Eisen?
Yes, Mr. Chairman. Corporation Counsel, while you're at the microphone, are you in a position to give us an update on the coroner issue?
I can tell you that he has indicated that the 31st will be his last day. And I can also tell you that litigation is ongoing.
Thank you, Supervisor Eisen. Thank you, Corporation Counsel. Any other questions for Corporation Counsel budget? All right, seeing none, we'll move on to the next budget, and that is the county clerk's budget, starting on page 95. Narrative starts on page 98.
The corporate counsel office has 3 full-time employees and 1 part-time employee for a total of 4, the same as the prior year. We're on county clerk?
County clerk.
County clerk.
Oh,
Yeah, and the main change from year to year in the county clerk's budget is that the number of elections changes dramatically. And this happens to be a cycle with more elections.
any questions in regards to the county clerk's budget? I'll call on Supervisor Norton.
Thank you, Mr. Chairman. Sue, when I was at NACO, I think in Washington in April, they said that they were appropriating money to states to help with election security. Has the state done that, and have your office received any of that, and what have you done, may I ask?
They have appropriated money to the state of Wisconsin. Right now, they're actually figuring out who should get that money. Right now, it's primarily being used for the municipalities because there's so many small municipalities that don't have, I should say, IT departments that can help them make sure that they're maintaining their not so much their voting equipment, but as their computers that the clerks use to register voters. So the big push right now is to give each, they've figured there's about $1,700 per municipality that they can put in an application for. And that would be to help them get IT support, maybe get updated software and make them compliant so that they can use the statewide voter registration system. They're actually going to have to become compliant within, right after the first of the years, or they won't be able to access that system. But we did have a meeting last week, and I actually spoke with Jay Schaefer, the cybersecurity person in the IT department. He was on the conference call with us. They're going to make some money available to the counties. They're not sure how much, but they really want counties to look into getting Albert sensors, which is another layer of security that monitors activity on the county's network. So Jay Schaefer is getting involved with that with us. We do already have security like that in place, but this is something else that the state is kind of recommending, so we'll see where that goes. But they haven't ruled out counties getting some money, but at this point we haven't heard an actual amount.
Thank you, Clerk Ertmer. Anything further, Supervisor Norton? No. Thank you. Next speaker, Supervisor Eisen.
Thank you, Mr. Chairman. Looking through the goals and objectives and the accomplishments and the duties that we have observed from the county clerk's office, you serve as a constitutional officer, but the work that you're doing is basic routine work, and particularly in Winnebago County, there doesn't seem to be a big partisan hoopla over the county clerk's office. Does statute permit the county clerk to be a appointed position? Is it something that you would recommend? I think you've been in the position in the county clerk's office for 40 years. And
Not as county clerk, though.
This is certainly something that you have observed over your career, and would this be something that the board could consider?
I think a lot of county clerks and a lot of the constitutional officers, treasurers, coroners, they're concerned about them not being elected. They feel that it gives the public an opportunity to install these people in these positions. The one thing that we've all discussed in the fact they really don't need to be they should be nonpartisan. You know, there really isn't a need, especially if the county clerks, we deal with everybody of, you know, all the political parties, and we need to be very unbiased and work with everybody. So that's really been more of a discussion that it be nonpartisan versus not elected. I know there's been a push for some of that to happen as far as having them being appointed positions, but it would take, you know, a constitutional amendment. So I don't know how fast something like that could happen. I'll probably be gone before that happens, so.
Yeah, it's not within our authority.
No.
That would take changes from the legislature.
Thank you, Clerk Ertmer, and thank you, Supervisor Eisen. Any other questions in regards to the county clerk's budget? Seeing none, we'll move on to the next one, and that's the county treasurer's budget, starting on page 115.
The county treasurer's office works with 4 full-time employees. The list of significant changes are on page 116.
We'll open it up for any questions in regards to the county treasurer's office. Seeing no, I'll call on Supervisor Eisen.
Thank you, Mr. Chairman. I observed from reading through the budget that the county treasurer brings revenue to the county rather than consumes levy expenses. Has it ever been considered that a income-generating department provide bonuses to its employees?
I will call on the county treasurer in the back. Please go right ahead.
Good evening. No, I have to say that hasn't been a thought or a process. Our expenditures, our revenues all go through the budget process the same as those that have a deficit levy.
Well, I think it would be appropriate that bonuses be given to employees. I've been after the Solid Waste Board to do that for a decade.
Thank you, Supervisor Eisen. Next speaker, Supervisor Fari.
Thank you, Mr. Chairman. My question is for the treasurer. On page 116, under revenue changes, impact on the levy, you list a decrease in the number of acres converted from agricultural assessment. For the benefit of this board and the public, would you explain that process?
Absolutely. It's an act that tries to maintain agricultural property. So if a developer goes in and buys a farm from a farmer, say 40 acres, and decides to put in a subdivision, they're charged a fee. Well, it's a conversion charge per acre of taking that land out of agricultural assessment. Agricultural assessment is maybe like $200 an acre. And when you take that out, then you've received the benefit of the agricultural assessment, and now you're taking it out of there. There's a cost or a charge when you remove agricultural land.
And what would that fee be?
It depends on the number of acres. I believe for 2019, and the cost is established by the state of Wisconsin. Up to 10 acres, I believe it's $571 an acre. I believe 10 to 30 acres, it is, I'm going to say maybe 400 an acre, and 30 acres and over, I believe it's maybe 230 an acre, somewhere in that area. Don't quote me on those. But that's about the ballpark of it.
Seems a little illogical. The more land you take on an ag, the cheaper it is to convert it, right? Yeah.
That's the way the state works.
Thank you.
Thank you for the response, County Treasurer, and thank you, Supervisor Fari. Seeing no other call-ins, we'll go ahead and move on to the next budget, and that is the Human Resources budget, starting on page 127, I believe, the organizational change chart.
The Human Resource Department is going from 8 full-time employees to 9 full-time employees, and from 2 part-time employees down to 1. So the total stays the same, but there's an additional full-time and 1 less part-time in the chart. And that's largely due to the addition of a risk manager to the Human Resources Department that's shared with the Finance Department budget. And Mike Collard's in the back of the room if you have questions.
We'll open it up for questions for the Human Resources budget. I see one, Supervisor Gabbard.
Okay, here goes my question to you, Mike, about health insurance, because this does concern me because I'm worried about our employees, and I get that they might have to change a doctor. I have 2 circumstances out in Joe Public area where increases were coming from health insurance companies, and bids were taken, and all the people were able to stay with their physicians, and it cost the employer less money. So I understand that government operates in a different manner than Joe Public, but I am concerned about employees having to pay a higher deductible when they're your average employee and you go up to like a $4,000 deductible for a family. That's a lot of money. So my question to you is, I know we're self-insured, And I know we've taken bids in the past, and I know that we had Affinity or Network at the time, and they gave us a good price, and the next year they were up 12%. So I understand all that. So tell me what happened this year with our self-insured. One of my questions on that is that also based on catastrophic claims? That out in the public, that is a case where if you have a lot of claims that are more catastrophe than just normal going to a clinic, they look at that because they have to make money off their premiums, otherwise it goes up. So the self-insured, that's the question I have about self-insured. And what was your take on not going out for bids this year?
Okay. Well, there's several parts to that, obviously, but first of all, I'll address the question of deductibles increasing. The deductibles are not increasing for 2020. They haven't increased for a couple of years. The deductibles for 2020 will, for the vast majority of employees, be the same deductibles as we've had in 2019 and in 2018. So it's $750 deductible per person with a $1,500 maximum deductible per family, and those amounts are not changing. There is a small exception to that, which is for members of the Deputies Union, the Deputies Association. Because of negotiations we've had, they have not agreed to pay the same percentage of the premium as other county employees have paid. So in order to counterbalance that a little bit, to make up for it and to make the plan fair across the county, across different groups of employees, we've raised their deductible a little bit, and that's only to $900 per person and $1,800 per family. So that's the only change in our plan that we've really made this year, is to change our prescription benefit manager, which is expected to save us at least $400,000 in 2020 for the year on prescription drug costs, which are a very sizable component of our healthcare spend. Secondly, on the catastrophic claims, I'll address that next if I may. We do have insurance to cover catastrophic claims. So we're self-funded, but we do have insurance to cover the very large claims. And we do bid that. We bid that every year. I got the final bid results back last week. We got 3 bids. The current provider, Sun Life, was slightly under their closest competition, which was Voya, for stop-loss coverage. We had budgeted an expected 25% increase in that stop-loss coverage because of the catastrophic claims that we've had. It came in at about 22%. So that's very good news. I think our consultant did a very good job helping us bid that out. I was very pleased with the results. It's obviously not a great number to say it's still a component of our healthcare spend going up 22%, but it is covering we have some very major claims that are happening on a yearly basis now, and so that has to be reflected in our cost structure. But we did send that out for bid, and we did send out the prescription benefit management for bid. In terms of our basic medical funding, we are self-funded, and it is for the reasons the county executive has described. But to back up a little bit, if you talk to the best experts in terms of who advise companies, larger companies, not real small companies, but medium to large companies, they all advise them to go self-funded, because in the long run you are not going to get subsidized by an insurance company. That's not how they work. The county executive was exactly correct. Eventually they need to make enough money to pay all your claims and all the administrative expenses and make a profit. I'd rather keep the profit. And you have to be well managed. There are a lot of, frankly, I know of municipalities and counties that are afraid to go self-funded because of the management difficulties, but it's something I've had substantial experience with, and I think we do a good job. We also have good consultants that we pay for, and they're among the best in the state, in my opinion, and they deal with hundreds and hundreds of employers and their health insurance needs. And so they bid hundreds of plans every year, and they know very well what's available in the market. There are only so many players in the market. We talk to them at least 5 times a year about this, about the prospects for making a change. And I never say, this is the way we're going to do it forever, because that's not how it works. You have to react to the market. I very much believe that. When I started with the county in 2013, we were with Network Health, which was an Affinity, now Ascension-based network. And it meant you got a very poor benefit if you didn't go to Ascension doctors or Affinity doctors. And I talked to a lot of employees who were very upset about that because they wanted to go to an Aurora doctor or a ThedaCare doctor, and they couldn't. There are a lot of different networks available out there. The one we have been using for the last several years is called United Healthcare Choice Plus, and it's probably the broadest network, the one that provides the best benefit to most employees, both throughout the state and even throughout the country and elsewhere. So it's a great benefit, and it's not particularly expensive. It's nevertheless true that you can often get a better price from a narrower network. But back to our experience with Network Health. You're right, Network Health raised their rates 12%, then they wanted 18%. They were still a narrow network. It got to the point where, okay, is it worth forcing our employees to go to Affinity doctors rather than ThedaCare or Aurora, if that was their choice, for only a 5% difference in the health premiums? No, it's getting too narrow. It's not worth it anymore. We shopped it around. We went for bid. We did have a maximum 10% increase one year from them, but then it went up higher as soon as that was eliminated. Then we shopped around. We went with Group Health Trust. And we got an insured product, not self-insured, from Group Health Trust, which is a counties association venture. It was the same kind of thing. They raised their price, the maximum the contract allowed them to the next year, and then the third year they wanted a great deal more. So we bet it out. Didn't like the results. No one was willing to give us as good a deal as we thought our own claims history justified. So we looked very carefully at the numbers and decided to go self-insured, self-funded. I believe that was a wise choice. I'd make that choice again today in a heartbeat. I think we've done very well. Our claims experience, of course, has been, there's a lot of money in health insurance. I just finished a day of employee meetings talking about health insurance. I started out by asking them if anyone could guess, how much the county dollars were in the health insurance budget, because employees need to hear that. That's an $18 million item, when you add health and dental insurance, and that's just the county share, not the employee share. So that's a huge chunk of our, taxpayer money that we have to spend wisely. I'm very aware of that fact, but we absolutely could bid out to be a fully insured program, but I'm quite confident there's not a entity out there that would offer us a fully insured long-term, commitment on claims without providing a very narrow network. And there are such out there. The city has gone to one last year. They're switching for 2020 to a different one. Hope they like it better. It's a very difficult experience for employees. Sure, there are places where you can switch insurance and not have to change your healthcare providers. But there are other times when, if we switch to Anthem plan and you like going to Aurora doctors, you're still going to be able to go to Aurora doctors. You're just not going to be able to go to Ascension doctors anymore. It may be just the way you're situated. But the only plans out there that could give us a better price than we're able to get self-funded is through the narrow networks. The Aurora, Anthem, there's a plan called Robin Health Plan, but none of them cover all three of the major networks in our area. None of them cover nearly as many other providers, other than the big chains, if you will. And none of them cover a broad network of people outside the state or throughout the state like ours does. So it's all a lesser benefit. We could pay less and get a lesser benefit. That's always going to be the case. There are many ways we could give a lesser benefit to employees and save money. Increasing deductibles among them, increasing the premium share being another, changing the plan design, terms and conditions would be a third. So there are many options to do that. On the other hand, I don't think our performance has been bad. We got a very good rate from Network Health for a while, and we got a good rate from Group Health Trust by bidding that out for a couple of years. But we kind of reached the end of that rope, and we're still at a fairly low premium, really below market rates, because we really did manage to, kind of get the advantage of their introductory deal and then get out when they tried to actually make a profit on us in both of those cases. You can only do that so long before they catch on to you. And overall, our trend has been favorable. If you look at a 6% increase, that's not a high increase compared to many I've heard of. The medical trend right now in the country is about 6% per year. in terms of the normal increase that you can expect in health insurance costs. Now, you may say we're just matching that. No, actually, we're doing significantly better because last year, in 2019, we budgeted to lose money in health insurance. We set the premiums artificially low. We planned to lose 5% on health insurance because we had fund balance. I know some of you have expressed interest in making sure we keep the fund balances where they should be and not tax people or, tax our employees, if you will, with benefit cutbacks to pay for it. But we budgeted to take out money from health insurance in 2019. That's happened. We're probably taking out, knock on wood, cross my fingers for luck, where we are right now. It fluctuates every month when I look at the claims. But probably a little less than we budgeted, but we did budget to take that out. And by going up 6%, we're only 1% or 2% higher than our real projection was for 2019. And our current projection, which again changes every single month when we get another month's worth of data, is at about 6.79%. That includes a deduction for the change we're making in the prescription benefit manager, which is going to save us a lot of money, at least $400,000. We project. It's all a projection. There's tremendous variability. But so right now we're very close to breaking even on health insurance as a projection for 2020, which is great to make that up in 1 year and to be back on a level playing field where we don't expect really the fund balance to go down too much further. It's at a good level where it is. I'm very comfortable with it, and I think it's where it should be in order to make sure we can smooth out the increases that might come the following year. So if we find we have a healthy fund balance for 2021, we might decide to again have a minimal or no premium increase as we did for 2019. So
Thank you very much. Very informative, and you answered a lot of my questions. Thank you.
Thank you, Director Collard, and thank you, Supervisor Gabbard. Next speaker, Supervisor Binder, followed by Supervisor Eisen.
I had one of the county employees call me and tell me with the prescription drug plan, a lot of the class 2 drugs are going to class 3, which are considerably more expensive. And it's $18 million budget item, and it's hard to believe, like we take a vehicle that's $30,000 and we put it out for bids, and we got something that costs $18 million and we can't actually put it out for bids. That we just take it for granted that we're the best. And this isn't our first go around with being self-insured. We were self-insured before and it didn't work, and it basically fell apart. All of a sudden, Outagamie County was in it, the city of Oshkosh was in it. It didn't work for either one of them. They got better rates than us. Their insurance went down this year, 7% in the city of Oshkosh. And ours went up $1 million. And it's like, we're all just supposed to sit here and say, well, boy, that's a good increase, If we would have went down 7%, that's $1 million less we'd have paid, and that we could have done something else was to pay our debt. So I just have a hard time believing, the consultant said them windows were going to be $1.25 million. They're $3.5 million. The consultant said the elevator was going to be $75,000 or $750,000. That's $1.5 million. What does this consultant? He says, well, you're getting a good deal. Well, if we're getting a good deal, the other people are getting a better deal, but we don't even know that because we didn't take the time to bid it out. And this is the second year I asked for it, and once again, it's like I say, we don't exist as a county board. What we say, we represent the people, but we have nobody to listen to us. We ask them, and they say, I'll look into it, and it just goes by the wayside. So I guess I beat this to death, and I'm sorry for taking all your time.
Thank you, Supervisor Binder. Next speaker, Supervisor Eisen, followed by Supervisor Buck.
Thank you, Mr. Chairman. I would like to make reference to the budget book, particularly on page 25, fringe benefits.
Page 25.
On this fringe benefit table, there's a line item called health insurance, and it compares the amount of money that the county has paid, the actual amounts for 2018, 17, and 16, and the budget request for 2020. As you can see, health insurance is budgeted at $16,292,877. That's the county's share. Now, if you go to the bottom of the page and you see the title says Employee Share of Fringe Benefits, it says health insurance, $2,221,756. That's the portion of the insurance that the employees pay. Now, the total is $18,514,633. Now I'd like to make reference to page 144, if you please. Now, if you go down to the bottom, next to the bottom line, the expense total, and you go into the column executive, 2020 executive, you see that the expense that is projected for health insurance is $17,728,627. And that includes the clinic. Now, my question is, please reconcile the discrepancy or explain the difference.
I can, if you permit me. In budgeting health insurance, one of the tricky things is that you don't know what the enrollment is going to be. You know, the real important number to look at that health insurance professionals often look at is, you know, the amount of cost per member per month or something like that. We budget by department based on full staffing. You know, so we start out with a health insurance number, at least, that is based on all vacancies being filled all year and there being no vacancies. When we have a vacancy, we budget it to be safe, because budgeting also reflects essentially spending authority to the department. So we have to, when we have an unknown, we have to budget at the upper end or maximum and have some cushion, is that we budget as if everyone's taking family health insurance and dental insurance. Right, so in the department budgets, when you add them all up for health insurance, you get a higher number than you do in the actual health insurance fund budget, which is based on historically where we expect to end up in terms of actual enrollments, how many family, how many single, how many double per month, each month of the year, which is more based on our historical experience and doesn't match up the number of health insurance policies essentially that are budgeted in the departments.
Okay, so then page 24 is a model, or it's a assumption based upon full employment.
Yes, it's really what's in
And
department budgets.
And the page
aggregated.
144 expense
No.
is based upon your past experience going forward, what you project the reasonable increases would be with what you know.
Yes.
Well, that explains the difference, and I appreciate that explanation.
If I can add something real quick. In very large departments, we start building the budget in the fashion that's just described, assuming that every position will be filled and that every new person will elect family coverage. But in very large departments where there's a regular turnover, we do make an adjustment that's based on the presumption that they will not, in fact, have all the slots filled for the entire year. And we make that adjustment on past experience. In a smaller department, you can't do that, because the small department's going to try and fill every position and carry that for the year, and then they'll exceed their budget authority just because they filled the slots they were budgeted for. But in the very large departments, we do put in an adjustment for that, a reduction in wages.
Thank you, Executive Harris. Thank you, Director Collard. And anything further, Supervisor Eisen?
Okay, I have another question, if I can be sure that I can access that information. Could you explain to us, now, for a decade, we had the insurance consultant appear before the county board annually to explain the existing plan and the options for the future before changes or no changes were made. We've gone away from that model since we have entered the world of the WCA Insurance Group. My question is, you've explained to us that employees have a $750 deductible with a maximum deductible of $1,500. What is the maximum out-of-pocket expense for the individual and for the family? That is, there's a co-insurance.
Yes. It's $2,000 per person, including both the deductible and the co-pays.
Okay,
So it's-
2,000 and 4,000?
Yes.
Okay.
That's for in-network, of course, but the vast majority of claims are in-network.
Yeah. Okay, well, my question is, do the employees have any choice of other options, such as taking a high deductible plan with perhaps a $2,500 deductible or a $5,000 deductible, participating in a health savings account, or participating in a health reimbursement account? Are these options available in our program?
Not currently, no.
Okay. Now, this is a reason that this should be presented perhaps to the board for consideration, so that issues such as Supervisor Bender has presented would be aired. There's a substantial reduction in the cost of health insurance if you go into a large deductible plan. Individuals ought to have an opportunity to assume the self-risk. Now, when my wife was employed with the city in Appleton, there was an option for participating in a health savings account, which enabled the employee to take a larger deductible and to put dollars out of pocket into a tax-deferred, tax-sheltered side fund, so that if we incurred a major expense requiring the deductible outside of a copayment, that we could access our money in the health savings account and offset the cost of that larger deductible. This would bring the premium down very substantially. And I argued this again and again and again over the last decade when the county was positioned with both a self-funded plan and a fully insured plan. There were two plans that were offered. I think it is appropriate that this issue be brought back to the county board, and if it takes a resolution such as I recommended to Supervisor Bender, this board can take has the authority to require that you do that, because I think you can save money from that $18 million by doing that. Having said that, The other issue I'd like to address is in respect to the clinic that we are funding at a cost of some $400,000. And my question is, what measures do you have and metrics do you use to demonstrate that the clinic is saving us money? Because it sounds like City of Oshkosh is pulled away. Perhaps they're pulling away from the clinic? No?
No, that's not true. They're still very actively involved in the clinic. We just
Well,
has-
nonetheless, if you look at the budget, you'll see on page 144 that clinic expense account number 55203 increased by 27% going forward to the new budget. And I think this is an issue that needs to have a little more light shed on it, because as a insurance professional, I've always harped on this from day one, and I've got volumes of recorded documents and notes that I have addressed to the board over the years. So with that, I allow you to, or ask for you to give us some good reason why or why not the board should have or not have some say in this matter, because there's a lot to be said.
Well, I don't know that it's for me to comment on what the board's scope of authority should be with respect to the administration or the county executive. I work for the county executive, and it's been my understanding here that the selection of the health insurance plan has been an administrative function. So those are the parameters I'm given to work with. It's up to you to decide if you want to do anything differently, but I do believe we've had a very professionally run and managed health insurance plan. I take to heart your comments about a health savings account, or more likely in our case, a health reimbursement account is something we'd look at. I have looked at such options from time to time since I've been here on several occasions. There are a lot of pluses and minuses with them. It depends where you put the numbers. You can't, and you also have to worry about selectivity. If you have multiple plans, each employee is going to choose the plan that is most beneficial for that employee. So the one that has a lot of expenses chooses the low deductible plan, and vice versa. So you end up with, a more limited set of options perhaps for some of the employees that like our current plan. So there's no perfect solution, but
yes,
they can be considered.
The people with lower deductibles pay higher premiums, and the people with higher deductibles pay lower premiums. That's what the result is.
Yeah.
Thank you, Supervisor Eisen. Next speaker, Supervisor Buck.
Thank you, Mr. Chairman. Mike, I have a couple questions for you. Health insurance costs are directly related to the age of employees, and just wondering what the average age of a Winnebago County employee currently is.
Going off the top of my head, didn't necessarily prepare for that question, but we do look at that number at least once a year, and I think it's about 47 and a half.
Okay.
Which is slightly above, but not enormously above, the average age for larger health plan groups in Wisconsin on average.
And for counties in general, that's a typical age?
Yes.
Okay. In your accomplishments, you said that you're doing career fairs or recruitment fairs, I guess. Do you find that that's beneficial for the county and bringing in younger folks? Would you like to see more of that, I guess? And are you producing any fruit off of those career fairs, getting folks to work for the county?
Certainly we have, and we've done a lot of different things, and there's no one-size-fits-all answer to recruiting.
Mm-hmm.
It's a much different recruiting marketplace than it was even 2 years ago, much less 5 or 10 years ago. Biggest needs are at the healthcare center.
Mm-hmm.
At Parkview Health Center, excuse me. I mean, we were running something like 32 FTE shorthanded just in nursing. We've been working very hard to close that gap. We did, for instance, make a change in some of those FTEs and established a hospitality aide position where we can hire people without the certified nursing aide credential, who can then take a lot of the burden off the certified nursing aides. And so we swapped 16 FTE of CNAs for hospitality aides, for instance. That's had a big impact already. We've filled up our 16 FTE of hospitality aides. We've also increased by about 4 or 5 FTE the number of CNAs we've had, and that's just in the last month. So we've been working very hard to do that with some success. I also think our turnover rate in some other departments is much higher than it was 5-10 years ago, but lower than what I've heard from some other counties, particularly in the sheriff's office. We have, correctional staff. I'm hearing desperate stories from other counties about correctional officers, for instance. Ours are in a little bit different pay situation because they are sworn and members of the bargaining unit, but it is showing up in the fact that we're much closer to fully staffed. Not always fully staffed, but we're getting close to it. We've had a big problem in the last few years maintaining booking clerks, for instance, in the sheriff's office. We spent a lot of effort on that, and we've been fully staffed for about the last year on booking clerks, although with some turnover, but being able to fill them more or less currently. So you have to try as many different things as you can in this market, and it's definitely a lot more online. We're doing a lot more advertising on Indeed as our principal vehicle now, but it's certainly not the only one. And but sometimes, especially for nursing positions or CNA positions, you have to get in front of them and see them face to face and say, "Hey, ever think about coming to work for us here? Great place." So those things are starting to pay off. I think we're doing pretty well. Always room for improvement. We're really trying to maintain a full staff as much as we can.
I think advertising that $750 deductible is quite the catch. Just one more question. Do we have retiree pre-funding in Winnebago County?
By pre-funding, you mean for retiree health insurance?
Yeah, so an employee retires at 55 or 60, and then they're pre-funded until Medicaid kicks in. We don't have.
No, we don't have pre-funding. We allow retirees to remain on the plan.
Okay.
But paying 100% of the normal premium.
That would be something with the health savings account that you supplement that number with.
Yeah, and we should take that back. There's an exception to that. We have a sick leave plan where sick leave accrued before a certain date, offhand I'm not quite sure of the year, can be converted to health premiums post-retirement. So there still is a fair amount of money in that plan. When people retire after many years, they might have quite a bit of sick leave built up, and that's converted through a 401a plan into health premiums they can use to fund the retiree insurance.
And accumulation of unused sick leave was frozen back in 2005.
Mm-hmm. All right, thank you.
Thank you, Supervisor Buck. Next speaker, Supervisor Shorsey, followed by Supervisor Smith.
Thank you, Mr. Chairman. Sounds like we may need a special orders opportunity to talk through some of these things. I just wanted to say that I worked in healthcare for 40 years, and in the mid-2000s, my deductible went up to $2,500 per person, and we had increases in premiums all the way along. We did have a tiered program for a while, so lower paid staff could, have a lower deductible. And then our deductibles went up to $5,000 per person. And when we had to go on Obamacare, God forbid, that was a horrible experience, our deductibles went up to $7,500 per person. So the county employees are still getting a really good deal. And I'm not saying that we shouldn't, be looking at bidding and all that sort of thing. And it's a never-ending target. It's a moving target, and it certainly, your cost of healthcare depends on the health of your employee base. So in terms of what's going on there, out there in the public sector, the county employees are very, very fortunate.
Thank you, Supervisor Shorsey. Next speaker, Supervisor Smith, followed by Supervisor Nussbaum.
Yes, thank you, Mr. Chairman. I just had we were talking about the numbers, people that are signing up for the healthcare plan. One of the things that occurred to me is that depending on the economy and married spouses may have better plans than ours, or our plan may be better than theirs. And I wonder how much of a consideration that is in reducing the amount of premium and coverage we're going to have.
Director Collard, do you have a response to that?
Well, I was talking with someone just this morning about that issue because more and more plans are now imposing essentially a penalty or a carve-out or whatever, however you call it. Yeah. They're essentially requiring an employee's spouse to, look to that spouse's employer for health insurance before they can come on our plan. And I think that's something we need to probably pay a little bit more attention to. There can be problems with doing that. I don't know how you enforce it, for one thing. It can be very difficult, but it's becoming enough more common that it might be something to look at. I suspect, we'd still end up with a lot of people on our plan, but it might have some impact. It's hard to estimate how much. I did put a provision like that in place once at a former employer where I worked, and it didn't have nearly as big an impact as I thought it would. So, but yeah, that's probably something we should talk more about.
Thank you. I think that's one of the things we need to look into.
Mm-hmm.
Thank you, Supervisor Smith. Next speaker, Supervisor Nussbaum, followed by Supervisor Norton.
Thank you. I'm surprised that we don't have an HSA, because that is a great benefit to the employees. I think it's something we should look at.
Thank you, Supervisor Nussbaum. Next speaker, Supervisor Norton, followed by Vice Chairman Egan.
Thank you, Mr. Chairman. On page 144, could you fully explain the 27% increase in the clinic expense, the 16% increase in the health risk assessments, and the double the expenditure for employee wellness?
Director Collard?
Yes, the clinic expense, well, there are a couple things. The clinic expense, first of all, includes both the Three Waves Clinic, but also this year we just added the clinic in Neenah, which we're sharing with the city of Neenah and some other employers, so that's also included in there. The clinic expense has been going up. It's been subject of considerable discussion. A big part of the increase, and I can't give you a precise dollar amount, but a big part of that is because our employees have been using the clinic more than our partners. So our arrangement for the clinic is we have the Oshkosh Area School District and the City of Oshkosh as partners. We measure usage of the clinic essentially by entity, by employer, so that each quarter we get a report showing how many times county employees went to see providers there, how many times city, how many school district. And we have a formula that we apply, that we apply a very simple weighting factor to that, and we end up with a percentage, which we then apply to bills for the clinic operation for the next quarter. So we've been paying a bigger and bigger percentage because our employees have been going more and more often compared with the city and the school district. So that's a big part of it. Another big part of it is the health coaching services that we've added. We have a full-time health coach who is doing a fantastic job. He started almost exactly a year ago today. And for a good part of that year, he was working mainly for county employees. We were paying 2/3 of the bill for his time, for instance. And that's had fantastic results. The guy is great. He's got a lot of people energized about addressing their lifestyles and improving their health risk factors. It's been a tremendous success. And I totally credit the individual that they hired to do this. We had someone before who was not nearly as effective. So we're doing a lot more there. We also added a disease management program, which is a targeted program addressed at people who have a chronic condition such as diabetes, type 2 diabetes, high blood pressure, high cholesterol. And we're providing incentives for people who have those conditions to come in, meet with clinic staff on roughly a quarterly basis, review their care plans, make sure they're following their care plans, providing educational materials so they understand the importance of maintaining their care, as opposed to, these are conditions that often people experience no symptoms from until they're real bad and have to go in the hospital, and then it costs us $80,000. And that's not an exaggeration. It can be hundreds of thousands of dollars. In the case of a severe diabetic, it's one of the biggest drivers of expenses on our health plan. And high blood pressure and high cholesterol as well. If you get into cardiac conditions, it can be $300,000 for a cardiac operation. So there's a lot of money involved there, and the best studies that have been done on employer wellness plans show that there's a lot of dispute about what the return is on investment for a generic wellness program. They're good things, but it's kind of hard in my mind to prove exactly what the financial return is from it. The one area where you can very clearly show a financial return is in exactly this kind of targeted disease management program. So we put that into place, and that's added to our expenses as well, because it's driving up the clinic visits and driving up the cost of the clinic staff and the health coaching. But that can have a big payoff. We're looking at $400,000 budget item out of 16 or 18 million. It's a fairly small percentage of that.
Thank you, Supervisor Norton. Please, go ahead.
Another thing, a couple of years ago at a WCA Legislative Exchange that you were at, County Executive, there was a presentation on how to attract or younger or diversified or millennials. And the speaker said, I believe in San Diego County, that they reached out to their universities and they tried to attract them by giving internships. I would like to know, A, have we tried that actively to the various departments who could use interns and try to get them come work for the county? And another thing about attracting recruitment, I know Mr. Supervisor Buck asked the question, do we have any type of program or thought about having a program, whether it's in nursing, CNAs, or any department, where we will pay for someone's training and then they come work for us for a certain amount of period? So that's my two questions. Have we actively tried to get interns from the various colleges in the area? And B, do we have a program where we'll pay for your schooling for whatever position? CNA is the most obvious, I would think, but maybe others, but you could have to come work for the county for, I don't know, X amount of years.
Let me make a couple comments, Mike, and then you can take it from there. But we do actually have several college students that work for the county on a seasonal basis, but not throughout the county. I think they're concentrated in the health department. But we're also doing other things to make ourselves more attractive. The board probably remembers not long ago you supported a shift differential out at Parkview. The millennials seem more adverse to working second and third shift, so we added a differential to see if that would help there. We've recently had discussions about changing the way we do our vacation policy, not giving additional vacation policy, but allowing people to access it sooner for new hires. So we're always looking at things to help us better match what young employees are looking for. We could probably do more.
And to supplement that, I would say we do have very active internship programs in two departments, Public Health and Human Services. They both do a lot of internships through the colleges. There are other departments that have interns from time to time, not as actively, I would say. So that's there. In terms of the schooling issue, we did institute just this past year a training class for CNAs to be held at Parkview, and that's paying some results, I believe. We're seeing some good results from that. That's, to my knowledge, the only pay for schooling program we have currently in the county.
I have one more thing, because the county executive reminded me. In June of 2018, you said you were going to look at changing the vacation policy. Last year at the budget session, I asked you, and you said, oh, that something will be presented to the personal finance by spring and probably to the board by July. It is now obviously budget time in October. can you guarantee me and the rest of this board that we'll have a change in what I call a antiquated vacation policy sometime in 2020?
Yeah, we've held a number of meetings, the finance director, the HR director, and Bill Topol. And we had a series of meetings. What we've agreed to do is to allow people to draw on their vacation in the same year that it's earned. And what this will do is it won't cost us more money over their career, but instead of people always having unused vacation when they retire or leave employment that we would pay out, instead they can choose to access it sooner, because where we were running into a problem was in the first year. Now, Mike, remind me on where we stand on that. Does that still have to go to P&F?
Yes, that I believe will be on the Personnel and Finance Committee agenda for the November meeting.
And in earlier meetings, earlier in the year, we had discussed a broader array of changes, but concluded that they become so messy and so hard to explain to employees, and employees either hating them or loving them based on how it affects them individually, that we scaled it back just to that vacation policy for now. But there are other employment benefit aspects that we're still discussing.
Thank you, Supervisor Norton. Next speaker, Vice Chairman Egan, followed by Supervisor Eisen.
Thank you, Mr. Chairman. Mr. Collard, a few years ago, right after you come here, I believe, because you said it worked so good at the previous employer, you went ahead and was going to put into a step program, like so those that were just hired were not getting paid the same amount as those that have been here for a while. You hired a new somebody to come in and help out and do a study and everything. Where were we actually at on that? All of a sudden it was dead, and I never heard anyways if it actually did any good. A lady come back and spoke to us once, and we heard no more.
Oh, well, yes, we've been putting that into effect. In fact, the board passed the compensation plan in July of 2016, which was a drastic change to our overall compensation schedules and methods. Before then, we already had started the merit pay program in 2015, so all pay increases, for the most part, with only very limited exceptions, are through the merit pay program based on performance evaluation. The pay plan that was passed in 2016 actually combined 17 different pay schedules into one. So, and they were very different pay schedules that were being combined, so that was a huge task. We did find as a result of that pay study that a lot of our starting rates in particular were very low, lower than the market and lower where they needed to be. So it was very difficult to get caught up because there was a lot of money involved. So we implemented the new starting rates that were recommended by the consultant over a period of 3 years. So 2017, 2018, 2019, we only fully implemented that plan and the starting rates recommended by the consultant in 2019. But we have had each year, some reclassifications of positions under that plan. We've had each year a small increase in the schedule itself. We're proposing, for instance, and included in this budget is an estimate of a 1.5% increase in the schedule, the starting rates for every grade. That will be coming to the board probably next month. It'll be presented to the Personnel and Finance Committee first. It's been our practice since we adopted the new plan. So I think it's been generally working well. My experience has been, and the experience of my department has been, that our starting rates are now, in 2019, much more competitive and accurately drawn with respect to the marketplace. You can never say it's perfect. There is always room for disagreement, but I think we're right about where we should be overall in terms of the starting rates. Now it's a matter of maintaining that plan and making sure we keep up with where the labor market goes, which can be difficult as well. And frankly, we do still have employees who are disadvantaged by the fact that they were perhaps long-term employees, but while the steps were frozen, and our pay plan is designed to really bring people to at or above what we call the control point by the time they're good, experienced employees, whatever that means. And it might be 5 years, it might be 8 years, it might be 10 years. But if you're not at the control point within 10 years, then our plan isn't really working the way it was designed if you're a good employee. So we have still some disparities, or some people who are still very close to the same pay, even though one was here 10 years longer. We can't ever claim to have worked all of those discrepancies out, but we're starting to address those a little bit. But overall, I think our compensation plan has been well implemented.
And if I can add something to that, so that when we do an employee review, we come up with a score, and then you have to go to a table, and how many units they get awarded depends on what quartile they're in of their pay range. So basically, there is a factor in there that gives a larger raise to someone who's lower in their pay range, and that's what helps move them to the middle. But here's the issue that makes that tough. If we're only allowed 1.37% to increase our budget, our raises are so skinny to begin with. And when you split them into two parts, one for merit and one related to what quartile they're in, then pretty soon the difference between a good review and a mediocre review is such a small fraction of a percent that it doesn't make much difference, and sometimes can actually be a disincentive for people. But that's the realities we live under. I mean, I've got to work with that 1.37%, and that's the maximum I can take.
Thank you.
Thank you, Vice Chairman Egan. Next speaker, Supervisor Eisen.
Thank you, Mr. Chairman. I'd like to refer to page 125, 2019 accomplishments for human resources. And I'd like to point out item number 1A. And I'd like to commend Human Resource Director on hiring 142 new county employees in the first 6 months of 2019. I think that by any measure, that's a terrific. That's 15% of our work staff.
Well, thank you very much. I appreciate that, and I have to say that pace has only accelerated lately. I think the last month, I'll have to look at the numbers carefully, but I think we probably set a record for hiring the most people in a month in the last September and October. Probably both were up there.
Keep up the good work.
Thank you, Supervisor Eisen. And thank you, Director Collard. I see no other call-ins, so we'll complete the human resources. Oh, sorry, Supervisor Snyder?
I don't necessarily have to speak, but Steve wants to. I signed out with my phone and it marked me absent.
Okay.
I just wanted to bring up the chart. Just, you know, if you happen to be an employee in the A category, you can get 7 shares. If you're an employee in the D category, you can get 4 shares. And what they do is they take that pot of money and they divide it up how many shares are awarded. So if a share is worth 1/4 point, a person that did a stellar job, but he's in category D, he's gonna get a 1% raise this year. Because the 2.5% we're giving goes by the amount of shares and what level you're at. So your long-term employees are basically gonna get a very small raise. I mean, if you're the best you can get, that's basically a 25 to 28 on your merit review, you can get 4 shares. So normally a share is worth about 1/3, 1/4 point, I believe. Last year what was the share worth?
To a half usually.
A half point last year?
It differed by department because we split it up by departments, but the lowest one was still above 0.4.
Okay, well, I'm just saying, but they basically, a long-term employee is gonna get a very small raise. And no matter how good he does, the most he can get is 4 shares. There's no, like, basically the city of Oshkosh gives a 2% raise across the board, and then they have a bonus anywhere from 500 to 1,000 depending how you score. Where basically our step raises used to be, you put 18 months in, you got a review by your supervisor. If he said you were doing good, you went to that step. But all the employees basically got the same raise, and they basically didn't get a 1%, and the next person gets a 2.5% raise. You know, when you get the same evaluation and one person gets 7 shares and one person gets 4, it sometimes causes a little bit of hard feelings.
Thank you for pointing that out, Supervisor Bender. Seeing no other call-ins, we'll go ahead and conclude the Human Resources budget. We'll move on down to the next department, that is the Finance Department. Starting on page 150, I believe the chart of organization change is 155.
The Finance Department will have 6 full-time employees. And did I misspeak when you were sharing the new risk analysts or safety?
You did speak about that with Human Resources. They're adding that position
In their
well,
depart-
in the workers' comp fund and the property and liability
Okay,
fund.
so that's why it's not in this one.
Correct.
But you are sharing that with Human Resources. So it's 6 full-time employees. It'll remain 6 full-time employees. The significant changes are on page 156. Questions?
Any questions in regards to the Finance Department budget? And so this includes property insurance, general services, miscellaneous unclassified, and debt service. Any questions? Seeing none, we'll move on down to the next department, and that's Information Systems, which also includes technology replacement. Starts on page 176 with Table of Organization Change 180.
Information Systems is budgeted for 18 employees, the same as last year. And that's 18 full-time employees. And the summary of significant changes is on page 181 and 182.
Any questions for Information Systems budget and technology replacement? Technology replacement, significant changes is found on page 189. Any questions? Seeing none, we'll move on down to the next department, and that's the county board budget. And that you should find on page 537. (537) and table organization changes on 539. That also includes the scholarship program, which is on page 545.
This is, largely where the expenses related to board travel and conferences and their per diems shows up in this budget. And it's really quite a bargain. When you consider how large our board is, our total budget is a very small amount.
Any questions in regards, I see one, Supervisor Brunn, followed by Supervisor Wojciechowski.
I'd like to make some comments on the scholarship program.
Please.
Currently, the scholarship program is pretty wide open. We were talking about internships and retaining employees. I'd like to think that we should keep the scholarship in-house and only fund students that are going to go to UW Oshkosh, Fox Valley Tech, or UW Fox. And that would keep these people in our county and maybe make them more likely to become productive taxpayers in our county versus going off to some school way far away. I know there are some career paths that do not go this way, but, well, I still like to keep it all in the county if we could.
Thank you, Supervisor Brunn. Next speaker, Supervisor Wojciechowski, followed by Supervisor Finch.
Thank you, Mr. Chairman. Do you have, or have you budgeted for any iPad replacements in this budget?
I believe it was the equivalent of 3 or 4 that we budgeted for, finance director. I'm pretty sure that was correct.
Yes, it looks like that's what you budgeted.
And what line item is that, if you could?
I think it's under like an equipment replacement.
Small equipment technology, which is on page 543.
All right, so I see 4,500 for that. And how many would that be replacing for? Or do we have a number?
I believe it was 4 off the top of my head.
Okay, thank you. The only reason why I bring this up is because this has been a discussion topic now on the IS committee about trying to implement a standardized replacement plan for these iPads or just county technology in general. We don't currently have one in system, and I think it's something we need to look at, for future people future chairs or just, leadership in general, to have something to look at and say, okay, well, in this budget, we're going to replace a third of our county technology equipment. So I would just encourage us to maybe look at that. It's something we'll be discussing at our next IS committee meeting, but just something to bring up. So thank you.
Thank you, Supervisor Wojciechowski. I certainly very much support that, and having a plan that would make it very clear each year. The way it's budgeted right now is essentially if there's an issue with one that we needed to replace at this time until we do have a policy. But I very much agree and would support having a replacement approach. So thank you. Next speaker, Supervisor Finch.
Thank you, Mr. Chairman. Myself and others started this scholarship program, and the idea was to help all of Winnebago County students to go to any college that they wanted to go to. If we do what I was just told a couple of minutes ago, then we're dictating strictly to Oshkosh University and maybe a smaller one, but it had to be in Winnebago County, which now the taxpayers that footed the bill throughout all these years, their kids, if they go to, like Stevens Point, they don't get it. So I have to apologize to you, sir, but this is for Winnebago County students, not for the colleges right here in Winnebago County. So, and these students their parents, they're footing the bill all the way through. And I will not vote to reject these kids to go to a different college. I mean, they got that right to go to a different college, and their dad and mom's taxes are helping pay for it if we keep it the way it is. But if we turn around and change it where you have to go to the Oshkosh University, no, I can't accept that, because now we're dictating where a kid can go. Thank you.
Thank you, Supervisor Finch. Next speaker, Supervisor Eisen.
Thank you, Mr. Chairman. It was several years ago that I maybe the first or the second budget that I had the privilege of participating in discussion. I had suggested that the board look into the idea of a zero-based budget, a budget that would take a good, healthy look at all of the programs, either in a cycle or each year, to the extent that we could determine whether they are performing well, whether we're getting bang for the buck, and whether there should be changes and how money should be allocated. That idea was not received very seriously, and so we muddled our way through year to year, making incremental changes to the budget. This year, I've circulated a document that I will discuss later on when the Human Services portion of the budget comes to the forefront. But I feel so inadequate in terms of trying to piece through the 800 pages of the budget and to make sense in something that I don't understand completely and I'm not equipped to navigate. I think that it would be a reasonable objective if we take a look at how little money it costs to operate this county board. I know for years I needled David Albrecht that Outagamie County spends 3 times as much in the administration of their county board for a staff of about 4 or 5 people on the chairman's, reporting to the chairman, full-time employees. I think it would be in good consideration that we consider hiring an auditor to enable the county board supervisors to navigate the budget. We get the budget the middle of October, and we are asked to come 2 weeks later to pick the budget apart. Many of us have participated in committees where we individually have gone over the various budgets of those departments that are within our jurisdiction of the committee. So some of us have knowledge of some departments, others of us have knowledge of other departments, but nobody knows anything about the whole thing, everything about the whole thing, or adequate information to be able to provide our citizenship, our citizens with the very best quality of decision-making. So I would put this under consideration to think about adding an auditor to the chairman's staff, a full-time employee who could follow through on the details of the various departments and budgets and advise this board professionally how to deal with our administration decision makers.
Thank you, Supervisor Eisen. Any other questions in regards to the County Board and Scholarship Program? Seeing none, we'll close that department. That actually concludes all our departmental reviews that we were setting as a goal to review this evening. It also sets us to our goal of between 8 and 8:30. So, now, I'll pose one question to the body. We do have one other department head that was going to be first on the docket at 8:30 tomorrow morning. I see our facilities director, Mike Elder, in the back. We could do one more department. He was going to be the first one tomorrow. And I'm seeing a lot of yay set, so why don't we go ahead and do the facilities department, and that'll be our final department for this evening, and then we'll adjourn after that. So we're going to move it right into the facilities and property management department. That starts officially on page 194. And the table of organization change starts on page 197.
The Facilities Department has 39 full-time employees, which is the same as it's budgeting for 2020 for 39, and that's the same as it was in 2019. The summary of significant changes is on page 199.
I'll open it up for questions in regards to the facilities budget. Seeing no questions, I guess we'll complete that budget as well. Thank you for being here this evening, Director Elder. Okay, so that concludes our departmental budget reviews for this evening, so we will start officially on the district attorney's budget tomorrow morning at 8:30. So there's no formal action this evening. We'll just continue with the reviews tomorrow. And therefore, I will entertain a motion to adjourn. I'll call on Supervisor Albrecht.
I move that we reconvene at 8:30 tomorrow morning, October 29th.
There's a motion and a second to adjourn until 8:30 tomorrow morning. All those in favor say aye. Aye. Opposed? Motion carries. We are adjourned. Thank you, everyone. We'll see you tomorrow morning at 8:30.